All right, I think it's 8:03, so I think in the interest of time, we'll get started. Thanks everybody for joining this evening. My name is Sherry McPhee. I'm the wound consultant for the Eastern Zone. The province now has 4 consultants, 1 in each zone. In our Northern Zone, we have Angela Arsenault, and in our Central Zone, we have Amanda Parsons, and Melissa Goss is in Western Zone, which is Zone 1. We also have Bernadette Mitchell-McDonald on the call tonight, and Bernadette is the coordinator for the Provincial Wound Program. And I just want to let everybody know I have muted all for this session. So at any time, if you have any questions or you want to make a comment, if you could just take a moment to unmute yourself beforehand so we'll be able to hear you. We encourage participation and questions, so just unmute yourself and we'll be able to hear you loud and clear. If there's other people in the room with you, if you could just put that into the chat box to let us know exactly how many people are attending so we're able to capture an accurate number of the attendance this evening. So as a provincial wound team, we're really pleased to introduce Nancy Myatt of Shoal Cove Sales Agency for the education session this evening. Wound care has always been a focus throughout Nancy's working life. She has had her entire professional career in healthcare, both within the walls of hospitals and in other nursing roles, as well as clinical corporate wound sales roles. So we're really fortunate to have Nancy with us this evening to provide this education session. She maintains an excitement and passion for providing positive clinical solutions for patients and clinicians alike. Years of representing large corporate wound care companies and products has led her to know a simple yet effective product like EDEMAWEAR. So Nancy supports many clinicians throughout the Atlantic provinces in their knowledge and their use of the EDEMAWEAR product. So thanks again, Nancy, for doing this for us. We really appreciate it, and I'll hand it over to you.
Thanks, Sherry. Appreciate your comments. Good evening, everybody, and I'll echo Sherry's comments. Thank you very much for taking time out of your evening to spend with us and learn some education and some tips and tricks with respect to EDEMAWEAR, a low compression product. So I'm going to jump in. I have a presentation, a PowerPoint presentation to share with you. And as well, I would ask that you would share with me your name, where you work, your role at that facility, and send that information to me for a draw. As Sherry mentioned, I belong to a company called Shoal Cove Sales Agency. My husband and I started this company about 18 months ago, and we represent several lines, some in healthcare, the EDEMAWEAR being that, and some other fun lines as well, Bugatti handbags, some Pilot pens, a few other different lines. But what I'd like to do is for every session that we've done this week, 2 a day, I put your name into a draw for a really nice prize. In order for that to happen, you do have to send me your information. Otherwise, I don't know who is on the call. So if you're interested in being put in for the draw, send me that information. My contact information is at the end of the presentation, and I'll reiterate what I just talked about as far as sending me the info. So I'm going to open my presentation and we'll get started. Can everybody see it? Sherry, can you see my presentation?
Yes, we can see it, Nancy.
Okay, perfect. All right. So again, my role is clinical support for a product called EDEMAWEAR compression. So EDEMAWEAR is a compression stockinette. Pardon me. You see a picture of it here on the right-hand side of your screen. So EDEMAWEAR is latex-free. It's a tubular compression stocking which provides mild longitudinal compression, so 15 to 20 millimeters of compression. Of course, the tighter the fit, the higher compression that's generated by the wales of nylon fabric with transverse lycra elastic fiber. Compression makes cornrows in the limb that it's applied on, and what I mean by that is with EDEMAWEAR you see an up and down indentation within the limb, and that's normal. EDEMAWEAR can be worn daily for up to 4 to 6 months before needing to be replaced. Again, that timeline varies depending on how the product is looked after and cared for. There is a regular EDEMAWEAR as well as an EDEMAWEAR Light. The difference between regular EDEMAWEAR and the Light is the amount of compression that's provided. The EDEMAWEAR Light is minimal compression, as you see here, about 6 millimeters of mercury, give or take. And that's designed for clients who are unable to manage a product that provides higher compression. We all know that some compression is better than nothing. And a lot of times compliance is the issue with these clients. So instructions for use when it comes to EDEMAWEAR. So for the most effective compression therapy, EDEMAWEAR could be worn all day and all night. EDEMAWEAR should be removed and repositioned at least once a day. If there are no skin concerns and under the direction of your physician, your wound clinician, your nurse practitioner, EDEMAWEAR can be left in place for up to 1 week. If there is a wound present, we certainly want to make sure that the cover dressing on that wound is sufficient and is controlling the exudate, and we're not seeing seeping of the exudate through to the stocking. If that is happening, if your client does have a wound under that EDEMAWEAR and you're seeing breakthrough of exudate, then you need to reassess that cover dressing. Machine wash or hand wash in cold water if the stocking is soiled or it's lost its shape. We recommend hanging it to dry. However, we do know that a household non-commercial dryer on the low heat cycle can be used without any negative impact to the EDEMAWEAR. Your client may need 2 sets of EDEMAWEAR to allow the alternate pair or stocking to be washed and dried. And as clinicians, we all know that almighty hydrogen peroxide will remove any blood stains, but do not use bleach on the EDEMAWEAR. I'm going to talk a little bit about measuring for the appropriate size of EDEMAWEAR for your clients. And with respect to measuring, any other type of compression product you've used, the instructions would be very similar. Although with the EDEMAWEAR, the sizing is very simple, and we will talk about that. So we want to measure the thickest part of the applicable limb. EDEMAWEAR is formatted and sized according to small, medium, and large, and it's color-coded, and I'll explain that to you. So the regular EDEMAWEAR comes in small, medium, large, and extra large. The small is up to 45 centimeters or 18 inches, and that actually has a navy stripe on it. The medium, 45 to 75 centimeters or 30 inches, has a yellow stripe, top to bottom. Large, 75 to 115, 46 inches, a red stripe. And the extra large, 115 to 150 centimeters or 60 inches, and that's an aqua stripe. When we talk about the stripe, I get asked very often, I get calls from clinicians saying, where should the stripe on the EDEMAWEAR be? Should it be on the front? Should it be on the back? Should it be on the side? The significance of the colored stripe on your EDEMAWEAR stockinette is simply for the indication of size. So your small has a navy stripe. Although I said this afternoon, I'll say it again. Somebody thought last night that the stripe looked black. Now it is a dark navy, but it is actually, it's not black. But again, we were a little confused because we thought maybe there was another product out there, or she thought there may be another product out there like EDEMAWEAR with the stripe. But I think it's just that the navy is dark on the small size. Medium is yellow, large is red, extra large is aqua. The EDEMAWEAR Light, which is different, of course, than the regular EDEMAWEAR, provides that low compression. So for those clients who absolutely cannot tolerate the regular EDEMAWEAR. It doesn't happen often, but it does happen. There is the EDEMAWEAR Light available in the small and medium, and color-coded again, purple and orange. However, the EDEMAWEAR Light is not listed on the Nova Scotia Provincial Wound Care Formulary, which means it's not covered. Bernadette or Sherry, would you chime in on that product?
Sure. So for the EDEMAWEAR Light, if you had a client or a resident who required the EDEMAWEAR Light, you would contact one of the consultant in your area, and we would hook up and have a conversation with you, because this would require approval through the exception process. So you would simply reach out to us, we touch base, have a conversation, and determine if the product is appropriate. And if so, we would send the approval exception form back to you.
Perfect. Thank you. So again, the EDEMAWEAR sizing is very simple: small, medium, large, and extra large. Little comparison chart. So my understanding is historically, TubiGrip was a product that was used often in long-term care and home care. So there is some significant differences when we compare EDEMAWEAR to TubiGrip. So right off the bat, the EDEMAWEAR is a longitudinal compression, meaning that compression is up and down, as opposed to the circumferential compression, which may cause a tourniquet effect. The EDEMAWEAR is one layer. So one layer of EDEMAWEAR delivers 15 to 20 millimeters of mercury of compression. The TubiGrip, you require 2 to 3 layers for at least 10 to 15 millimeters of mercury of compression. The EDEMAWEAR is simple sizing, and this is a piece that for anybody who has ever worked in stores or procurement, this is a big thing for them when it comes to stocking product, having product on the shelf. So the simple sizing of EDEMAWEAR, there's 4 sizes or 4 SKUs: small, medium, and large, and extra large. With the TubiGrip, historically, there's actually 10 different sizes or SKUs. So A, B, C, D, E, F, G, J, K, L. The 5 most common are these C, D, E, and F, G that I'm told. So when we look at the EDEMAWEAR small, that actually will cover what you've used in the past from a TubiGrip sizing. So B, C, D, and E, EDEMAWEAR small. EDEMAWEAR medium, TubiGrip, F, G, and J. So when we look at the comparison of sizing, 2 SKUs, 2 sizes, the EDEMAWEAR small and the EDEMAWEAR medium will cover the majority of those 10 different sizes of the TubiGrip. EDEMAWEAR is latex free, and of course TubiGrip is not. This is a great feature too, in my opinion. The EDEMAWEAR is individually packaged. So it comes in a sealed pouch, as opposed to the TubiGrip, which comes open stock, non-sealed rolls in boxes. So every time that box is picked up by fingers or hands, an amount is chosen, a guesstimate of what's required for a client, and then it's put back on the shelf. It's far from ideal from an infectious control secure handling standpoint. So again, the individually sealed packages of EDEMAWEAR is, I believe, a great feature to have in the day and age that we live in. Product lifestyle, when we compare the two, very similar, 4 to 6 months with regular hand washing, proper washing and care. However, I'm told by clinicians, and again, this is anecdotal information, TubiGrip starts to lose its compression amount after the 3rd washing. The amount of compression, so 1 layer, of course, of the EDEMAWEAR, provides you with 15 to 20 millimeters of mercury of compression. TubiGrip, as we know, 8 millimeters, 1 layer. That's why we have to start adding multiple layers, 2 and 3 layers, to get a reasonable amount of compression for our clients. And of course, with that many layers comes the issues of it being warm, hot, bulky, and uncomfortable. So compliance becomes a huge issue with compression. We know that. So with the EDEMAWEAR, it's one layer, and how it is designed, there's spaces between those wells which allow for evaporation of moisture. You'll see here just very simple pics of how EDEMAWEAR is packaged. So small, medium, large, and extra large. Note that they're manufactured and packaged. The small EDEMAWEAR is actually packaged in a pair, so 2 in a package. However, the medium, large, and extra large are packaged in eaches, so single. So if you have a client who requires a medium size after doing your accurate measuring, a medium-sized EDEMAWEAR, you will have to order 2. Okay, so again, just to repeat that, the EDEMAWEAR small is in a pair. Small, medium, and large are singles or eaches. So keep that in mind. We want to make sure we apply an appropriate cover dressing, as we stated before, if there is a wound present. Then apply your EDEMAWEAR. And to apply, you're going to roll the stocking like a sock, and I have a video coming up. We want to apply that roll, almost looks like a donut, to the foot and then roll it up the leg. We want to make an 8-centimeter cuff at the top of the stocking, and this is to prevent a rolling of that stocking, ensuring that the top cuff is at least 2 finger widths below the back of the knee. Again, this is very similar to other products you may have used in the past. We want to make sure the stocking, the EDEMAWEAR stocking, is smooth, no wrinkles, no creases. If the EDEMAWEAR is slipping, you can actually remove it, turn it inside out, and reapply it. And if it's still loose, perhaps you might want to remeasure and select a different size of stocking. So I'm just going to talk through this, and there is some music, but we've had some difficulty with that. So again, you'll see the clinician here is measuring appropriately. She's measuring the thickest part of this gentleman's thigh, and now the length, to make sure she's going to choose the appropriate size to provide the most optimal amount of compression for this gentleman. So again, you see here, based on that, he would require a small EDEMAWEAR, and there is a pair in that small, remember that. You'll see here her rolling the stocking, the small with the blue. It does look like black, but it is blue stripe, and that indicates the size of the EDEMAWEAR. So if you walk into a room and the client has a pair of EDEMAWEAR on with a blue stripe, you know it's a small. So for reordering purposes, that's a good information to have. So she's rolled it like a donut. Now she places it on over the toes to the base of the toes and rolls it up the leg. I'm sure you've all at one time or another either put on or taken off compression garments. So she wants to make sure that there's no creases or wrinkles. She wants to make sure that's nice and smooth against the client's skin. Now she's going to make a little cuff at the top, making sure it's appropriately placed away from the back of that knee. A couple of finger breaths. You'll see at the top, the top is a little rolled out. Simply she's just going to turn it inside out and reapply it. I actually wore EDEMAWEAR myself. Unfortunately, I broke my knee about 2 years ago. In about 6 to 8 months, I was faithful with my EDEMAWEAR. And I learned this very quickly, that I could turn it inside out and then it would rectify the rolling. This is the medium size, of course, with the yellow stripe. So she wants to cut this because it's a little too long. So she measures at the base of the toes and marks it off. She removes the sock, then she cuts it to the appropriate size. And EDEMAWEAR does not unravel, so that's something that's a feature. Now she's going to remove the sock, same way she put it on, opposite, roll it back down the leg. We want to, as we stated before, remove it at least once a day for bathing. Examination of the limbs. We want to make sure we know what's going on underneath the compression garment. Machine or hand wash, and dry in a household dryer, not a commercial. And one pair should last up to 4 to 6 months, depending on how they're taken care of. So some contraindications when it comes to EDEMAWEAR. And these contraindications are no different than any other type of compression garment that you may have provided to your patients or your clients. So we don't want to use EDEMAWEAR in the presence of uncontrolled heart failure, and that optimal word, uncontrolled. Do not use in the presence of an untreated lower limb, skin, or wound infection. We want to make sure those issues are dealt with. And of course, use the light version with approval for legs with predominant bony prominences, because we want to prevent tissue damage. EDEMAWEAR should not be slipping down or bunching around the ankle, as this may cause a tourniquet effect. With regard to the availability of EDEMAWEAR, the local distributors in Atlantic Canada are Medical Mart and Medline. They're here in Dartmouth, over in Dartmouth, as well as Best Buy Medical are in Shediac, New Brunswick. So these both distributors, these Atlantic Canadian distributors, stock EDEMAWEAR. My contact information. So again, I am local. I'm actually on the south shore of Nova Scotia, overlooking the ocean in beautiful Blandford, I'm proud to say. In and out of Halifax all the time, and I do travel around the Atlantic provinces in more normal times, of course, when COVID wasn't dictating all our lives. So again, my email address and my phone number. Your wound care consultants also have my contact information. So I want to thank everybody for joining. And as I stated at the beginning of the presentation, if you